Are you an elder having a harder time caring for yourself? Or do you take care of an elder? Do you worry that if you ask for help, someone will try and move you out of your home or put you in a nursing home? What are home and community-based services, or HCBS, and are any services available for elders in Colorado? Are there options that let you get help at home while staying in control of the care you get? Do I get any HCBS from Indian Health Services, or IHS?
Medicaid is the primary source of care for elders like you to stay healthy, independent, and at home. IHS and Medicare do not provide these services. Medicaid provides health insurance, as does Medicare, or an employer's insurance, and offers many choices for long-term care. One option is home and community-based services, which is our focus in this video. If you choose HCBS, you will work with a case manager to create a care plan that meets your specific needs. You can choose who comes into your home, when they arrive, and how they help care for you. Sometimes your friends and family might get paid for the care they're already giving you. Home and community-based services are not only about getting the care you need, but are also more affordable. The cost of receiving services at home is less than the cost of care in a nursing home or assisted living, and if you're eligible, the costs are paid by Medicaid. If you live in a rural area or a reservation in Colorado, HCBS can connect you with caregivers nearby who might even be your friends or family. These caregivers receive pay, training, and support from expert staff like nurses and certified nurse assistants. Knowing you can get affordable, quality care right at home is reassuring. Every state gets to design its own HCBS program, and Colorado calls their program the Elderly, Blind and Disabled Waiver, or the EBD waiver.
I'd love to hear more. Specifically, what services are available for EBD waiver participants?
First, you would receive the comprehensive benefits of Medicaid health insurance. Many services are covered, such as doctor visits, hospital and emergency services, labs, x-rays, behavioral health, substance abuse support, prescription drugs, physical, occupational and speech therapy, transportation to medical appointments, dental, vision, and home health. Services are offered for very low or no copays. The waiver lets you access all the Medicaid insurance benefits and opens the door to additional services you can receive at home. These services are based on your needs and may include adult day services, home-delivered meals, home modifications like ramps and grab bars, and home accessibility adaptations, homemaker services, life skills training, transportation to medical appointments and other important places in your community, peer mentorship, personal care, personal emergency response system, remote support, respite, and transition setup. The Elderly, Blind, and Disabled Waiver pays for the service and lets you decide how you receive care. Colorado offers 3 options. Care from a home health agency. The Consumer-Directed Attendant Support Services, or CDASS option, where you get a set amount of hours for care and a budget and have total control of who you hire and what you pay them. With this option, you can utilize on-site adult day programs. The In-Home Support Services option is a hybrid. You can choose your caregivers, and a home health agency will train and pay them for your care and send agency staff when you need extra help or your caregivers are unavailable.
This sounds great, but how do I sign up for the EBD waiver?
The application has 2 steps. You start with the financial application by contacting Health First Colorado. You can apply online, over the phone, by mail, or in person at an application site. On this application, you will want to tell them that you are interested in applying for the EBD waiver because the income requirements are specific. The specialists at Health First Colorado will make sure you are over the age of 65 or have a disability, are a U.S. citizen and a Colorado resident, have a monthly income less than 3 times the SSI standard benefit, and have resources under the limit. Resource calculations can be complicated, but typically include money in your bank accounts or investments, but do not include your primary home and the vehicle used for your transportation. When you finish the financial application, you need to contact a case management agency, where you will be assigned to a case manager based on where you live. Your case manager will come to your home to learn more about you and your needs. This process is known as the functional assessment and determines your level of care.
Wait, why does someone come into my home and ask me personal questions? Can you tell me more about this functional assessment? What if the case manager doesn't like me or my house? What if they want to move me somewhere else?
These are all good questions. Letting a stranger into your home may seem uncomfortable. The good thing is your case manager is a trained professional who has your best interest as their top priority. It's essential to be honest about what you're struggling with and where you need help at home, because this allows them to create a care plan specific to you. Let's face it, no one wants to talk about going to the bathroom or struggling to take medicine properly, but it's really important. The functional assessment is a tool to gather information about your health needs and what it will take to keep you in your home. Your case manager will also evaluate your ability to eat, bathe, use the toilet, walk, and take medicine. These are called activities of daily living. You are encouraged to have a friend or family member with you during the assessment to take notes, to ask and answer questions, to advocate for you, and to share your story. The Colorado Elderly, Blind, and Disabled Waiver offers elders the choice to receive support that keeps you healthy while staying in your home and community. There is a resource page attached to this video to help you get started.